Hey everybody, Dr. James Fedich here, Village Family Clinic. Here to talk to you today about spinal decompression. So we're here in our decompression room. We have two spinal decompression tables and show you a little bit more about them and talk to you about spinal decompression today. So what is spinal decompression used for? We've talked about a couple different things over these video courses, but one thing, we're going to see two major things that we use these for. It's disc problems, disc herniations or disc bulges, and spinal stenosis are two of the most common conditions that we're going to use these tables for. So one, give a little quick anatomy lesson. We got the bones of vertebrae. The disc is the shock absorber or spacer in between there. And what I tell patients is kind of like a jelly donut. So there's jelly inside and there's kind of fibers holding it all together. So disc can do two things. They can bulge, and that's basically where the disc is, the jelly is still in the donut. It's just pushed out a little bit. And a herniation is when the jelly is actually coming out of the donut. It's the easiest way to think about it. So if you look at this as the disc in here, this is bones of vertebrae, and in between exits a nerve that goes different areas. One of the most common problems for this is in the lower back, and those nerves go down into the legs. So everybody's kind of had a friend with sciatica over the years. And so what will happen is some of that disc material can come out and put pressure on the nerve. It's not actually the disc that hurts. I said that before, the discs don't have nerve fibers, so the disc isn't hurting you, instead it's hitting the nerve. So there's, acupuncture, chiropractic, physical therapy, we do all that stuff, which is good to help in the pain, but ultimately if we can get that disc off of that nerve, you'll get long-lasting relief. And that's what spinal decompression does. So if we're laying on our tables here, when the vertebrae are like this, the table gently stretches apart and we'll see some of that disc actually come back in. So in a more medical terminology, it creates what we call a negative pressure inside there, kind of a little bit of vacuum, and it can suck some of that disc material in. So I tell patients, we're not going to make the disc look like you're an 18-year-old again, but the thing with the disc is it's only hurting if it's rubbing the nerve. So the disc itself isn't hurting. So a lot of people, about 15% of people have a herniated or bulging disc and have no idea, because it only bothers you if it's rubbing that nerve. And that's kind of a good thing, because if we can do the decompression table and get pressure off that nerve, we'll get you some long-lasting relief. So how we do this is especially controlled tables here behind us. So we used to have big traction machines. We used to actually have bigger ones here. These are the newest models. It has a pulley system hooked up to a computer control panel, and there's a upper pulley and a lower pulley. It's going to kind of strap you in. It's real comfortable, but it's going to gently traction or pull apart the spine to create that negative pressure. Now, years ago, the machines would just pull and pull, and we found out that can be uncomfortable and cause some problems. So it makes these spinal decompressions, they follow a computer-controlled algorithm where it pulls, holds the pull, releases the pull, and it goes through basically a wave of holding and pulling patterns, and we set that on the computers based on what we're doing for you. But that is much more comfortable. Patients fall asleep in here all the time, so it's really good. The other most common condition that we see for decompression, there's other stuff we do as well, is spinal stenosis. So you've had your friends or family say their knees walking bone on bone, that can certainly happen. And the spine will do the same thing. So as we get older, these vertebrae get closer and closer together. And a lot of closing in can happen at this tunnel in the back where the spinal cord is. So basically the tunnel slowly closing and closing on that nerve, and it can cause some problems as well. So it's a little bit different problem, more age-related. We have a lot of people with that here. And same idea, if we can pull and open that tunnel up just a little bit, they can get a lot of relief here. So I'll give you just a quick look at this table. I'll get up for you. But they're really not scary. People sometimes look, they think they're scary. They're really not scary. Really, you come in, lay down on your back. We can actually do it on your stomach as well. Some patients prefer that, but most people are laying on their back. You're going to be here with a nice pillow. We have our friendly staff. They're just going to be just one strap around your waist. This will just go around your waist. And then we're going to have one strap that goes up top, and it'll hold your arms here. This will hold your bottom half here. And they'll hook you into the pulley, and the pulley stretches really gently in a computer-controlled manner to open up that space for you. It's real gentle, relaxing. Well, people have said every day we got somebody falling asleep on here. These are the newest generation. If you saw some of the older tables, they're a lot bigger. This is the second generation that has been around for a few years, where they're a lot smaller, but they actually have a stronger motor, so they actually pull stronger in a smaller motor case. Another nice thing with these next generation is we can actually do necks and lower back. So if you're exposed to spinal decompression, years ago they could only do this lumbar spine, the lower back, and that was the machines we had when they first were approved in 2005. They only did lower backs, and these new models can do your neck or your lower back. So they're a really great addition. A lot of people ask too, there used to be an extra charge for these. We do not charge extra for our decompression therapy here. It's just part of our treatment plans here, whether you're paying through cash or through insurance. We don't charge an extra fee for decompression on top of our normal fee. So hopefully that's some questions about spinal decompression, and I'll talk to you soon.